You trust us. You come to us when you're scared, when you don't know what's happening to your body, when the pain becomes unbearable. You look at us as the ones with the answers. You have no idea how often we don't have any. I worked in a hospital for 10 years. And if you think medicine is about saving lives, about compassion and humanity, you're wrong. Medicine is a business. Cold, ruthless, with clearly defined priorities. Patients? They're not people. They're numbers. A source of revenue. A bet that needs to be freed up as soon as possible. I used to believe in the romanticized version of this world. I thought hospitals were places where people fought for every life, where doctors were heroes and nurses were angels in white coats. But I learned very quickly that real medicine has nothing to do with what they show in TV dramas. The first hit to my illusions came in my very first month on the job. I was still trying to do everything right, carefully following instructions, double-checking prescriptions, watching over patients closely. Then came one night shift. A man, 42 years old, seemingly healthy, brought in with chest pain. I could see he was struggling, but the doctor barely glanced at him, probably just indigestion. Give him some antacids and have him wait. He didn't wait. He died right there in the ER waiting room chair. A heart attack. We didn't even get the chance to do anything. And you know what happened next? Nothing. No investigation, no serious discussion. The doctor didn't even seem particularly shaken. It happens, he told me. Back then, I still didn't understand what that really meant. But then I started seeing it everywhere. Patients being discharged too early, not because they were ready, but because insurance wouldn't cover extra hospital days. Diagnoses made in a rush, not because they were accurate, but because time was limited and beds were needed for new clients. Expensive medications prescribed, not because they were the most effective, but because the hospital had lucrative deals with pharmaceutical companies. You think doctors always know what they're doing? That their decisions are always backed by certainty? Let me tell you a secret. 80% of the time, they're guessing. They diagnose not because they're sure, but because they have to make a decision fast. Sometimes they get it right. Sometimes they don't. The worst part wasn't just watching people die. It was watching people die when they could have been saved. Not because of incurable diseases, not because of tragic accidents, but because of bureaucracy, cost-cutting, and sheer exhaustion from overworked doctors and nurses who simply couldn't keep up. I remember one woman. She came in with a mild fever. Nothing serious, it seemed. They gave her the usual medications, told her to rest. A few days later, she came back, this time in critical condition. It turned out she had a rapidly progressing bacterial infection, eating her alive from the inside. She could have been saved if they had done proper tests the first time. But it was just a fever. Why waste resources? She died in the ICU that night. And the scariest part? Even worse than what I saw? The fact that I got used to it. At first I was outraged. Then I was angry. Then I just accepted it. And that's the worst part of all. Because if even I, someone who once dreamed of helping people, became just another cog in this machine, what does that say about everyone else? So tell me, do you still trust hospitals? I remember the first time I walked into a hospital as an employee, not as a visitor. I had this strange mix of pride and nervous energy, like I had finally stepped into the world I had been dreaming about for so long. Everything felt important. The beeping of monitors, the hurried footsteps, the quiet hum of people working together to keep the system running. I had made it. I was part of something bigger than myself. I thought I knew what to expect. I had spent years studying, memorizing protocols, passing exams, preparing for the long shifts and emotional exhaustion. But none of that really prepared me for the reality of working inside a hospital. The textbooks didn't mention how the fluorescent lights would make your skin look sickly after hours without a break. They didn't talk about the smell, antiseptic mixed with something sour, something human. They never warned you about the weight of exhaustion pressing against your skull, or the way the silence of an empty corridor at 3 a.m. could feel heavier than the chaos of a packed emergency room. I was eager back then. Too eager. I believed in the system. I trusted the protocols, the hierarchy, the idea that medicine was a science, precise and structured. Doctors diagnose, nurses assist, patients get treated, and everyone does their job to make sure people get better. That's what I thought. That's what I was supposed to think. The first cracks in that illusion appeared early on, though I ignored them at the time. I remember a patient, a woman in her late 50s, admitted for a simple gallbladder removal. Routine surgery, nothing complicated. She was anxious, like most people before an operation, but I reassured her. Told her she was in good hands. That's what we were taught to say. And I believed it. Her surgery went fine. But she developed a post-op infection, nothing extreme, nothing that couldn't be treated. She needed to stay for a few extra days just to be safe. That's what should have happened. But her insurance only covered a 48-hour stay for this type of procedure. After that, it was out of pocket. And she couldn't afford it. The doctors knew she wasn't ready to leave. The nurses knew it. But the system didn't care. The discharge papers were signed. She was sent home. 3 days later, she was back, this time septic, her body overwhelmed by the infection that hadn't been treated properly. This time, the hospital had no choice but to admit her. They did everything they could, but it was too late. She didn't make it. I kept telling myself it was a rare case, an exception. But it wasn't. It happened all the time. Hospitals aren't built for patients. They're built for efficiency. For numbers. For maximizing bed turnover. Every day, administrators make decisions not based on what's best for the patient, but on what's best for the hospital's bottom line. And the doctors? The nurses? Most of them want to help. But they're trapped in the same system. They don't make the rules. They just follow them. I started noticing other things. Little things at first. The way expensive procedures were always pushed, even when they weren't strictly necessary. The way certain brands of medications were prescribed more often, not because they were the best, but because the hospital had a deal with the pharmaceutical company. The way some patients were treated differently based on what kind of insurance they had. And then there were the shortcuts. The things we weren't supposed to talk about. Did you know that in some hospitals we reuse supplies meant to be disposable? Needles, gloves, even catheters, sometimes repackaged, sometimes just wiped down and set aside for the next patient. Not because anyone wants to, but because budgets are tight and administrators are always looking for ways to cut costs. Did you know that doctors sometimes write prescriptions without even seeing the patient? A nurse will describe the symptoms over the phone, and that's enough. Give them something mild and send them home, they'll say. And most of the time they're right. But when they're wrong, when they miss something serious, patients trust the system. They shouldn't. I trusted it too at first. But I was starting to see what was really happening. And the scariest part? No one seemed surprised. I started noticing patterns. The same stories, the same mistakes, the same quiet cover-ups happening over and over again. At first I thought they were accidents, unfortunate but rare. Then I realized they were routine. You don't understand how much of medicine is built on calculated risk. Not the kind you see in dramatic medical shows where a genius surgeon makes a bold move to save a patient at the last second. No, the real risks in hospitals are quiet. Invisible. They happen every single day and most people never even realize. Let's talk about medication errors. You'd be horrified if you knew how often they happen. A patient is supposed to get 10 milligrams of a drug, but the nurse is rushing between too many beds and accidentally gives 100 milligrams. Or a doctor's handwriting is illegible on a prescription and the pharmacy reads hydromorphone instead of morphine, a mistake that can be fatal. Or a patient is allergic to a certain medication, but their records weren't updated properly, and they go into anaphylactic shock because someone assumed they were fine. You assume these mistakes are rare. They're not. They happen every single day. Some are caught in time. Some aren't. And the scariest part? Hospitals don't like to report them. See, there's this thing called incident reporting. In theory, any mistake, any error, no matter how small, should be documented, reviewed, and analyzed to prevent it from happening again. But in reality, no one wants to admit when something goes wrong. Nurses are discouraged from filing reports because too many incidents make the hospital look bad. Doctors cover for each other because no one wants to be the one blamed for a fatal mistake. Administrators manipulate statistics so that when they send reports to higher-ups, the numbers don't look too alarming. And patients? They almost never find out the truth. I've seen cases where a patient died because of a miscalculation in their treatment, and instead of admitting fault, the hospital simply wrote, complications due to underlying conditions on the death certificate. Because if they admitted it was their mistake, there could be lawsuits. Investigations. Bad press. It's easier to let families believe their loved one just didn't make it. And then there's the issue of hygiene. You assume hospitals are the cleanest places in the world. Sterile. I've seen people die from infections they caught in the hospital. Infections they never would have had if they had just stayed home. They believe hospitals are designed to save them. They believe doctors always know best. They believe their prescriptions are carefully chosen for their condition, not because a pharmaceutical rep offered the hospital a better deal for pushing a specific brand. But once you see it, you can't unsee it. I don't think people understand just how much of medicine is improvisation. The image most people have of a perfectly controlled system, where every procedure is carefully followed, every diagnosis backed by science, every decision made with precision, that's a fantasy. The reality? It's a mix of educated guesses, rushed decisions, and hoping for the best. And sometimes that hope runs out. I remember one particular night shift. The ER was packed, short-staffed as usual, with patients waiting for hours, the air thick with the sound of groaning, coughing, the occasional shouted demand for painkillers. A man came in, middle-aged, sweating, clutching his stomach. He had been to another hospital earlier that day where they dismissed him with a prescription for heartburn medication. Said it was probably acid reflux. It wasn't. By the time we ran tests, it was too late. His aorta had ruptured. A silent, deadly ticking time bomb that had been missed because someone had been too busy, too distracted, or maybe just too tired to take a closer look. If they had caught it hours earlier, he could have survived. Instead, I watched as a team of doctors and nurses frantically tried to stabilize him, their voices sharp, movements automatic, but we all knew how this was going to end. He was gone within the hour. And you know what happened next? Nothing. No review. No deeper discussion of why it was missed. No changes in protocol. Just another body moved to the morgue, another bed freed up, another file marked as complications. That's how hospitals work. They don't have time for reflection, for lessons learned. There's always another patient, another crisis, another shift starting with another batch of exhausted staff just trying to make it through the night. And if you think doctors are the ones running the show, you're wrong. Hospitals are controlled by administrators. People who have never held a scalpel, who wouldn't know the difference between a heart attack and a panic attack, but who decide how many staff members are scheduled, how much time a doctor is allowed to spend with each patient, which procedures are cost-effective. And they are obsessed with numbers. Every minute a patient stays in a bed is money. Every extra test, every scan, every pill handed out, profit and loss calculations behind each one. Did you know that some hospitals intentionally keep ER waiting times long because statistics show that desperate, frustrated patients are more likely to accept unnecessary tests and treatments just to get seen faster? I once had a patient who came in with a minor infection. He just needed a short course of antibiotics, maybe an overnight stay at most. But his insurance was one of the good ones, the kind that covers expensive tests and procedures without too many questions. By the time he was discharged, he had been put through multiple scans, unnecessary blood work, and had spent 5 days in a bed that someone else actually needed. Was he sicker when he left than when he came in? No. Did he get the care he needed? Yes. But did he need to go through all of that? No. It was business. And I watched it happen every day. It's a strange thing, working inside a hospital. You're constantly surrounded by suffering, by people at their most vulnerable, yet you're expected to move through it all like a machine. You can't stop. You can't take a moment to process. If a patient dies in one room, there's another one waiting in the next. If a mistake is made, you don't get time to dwell on it. You just have to keep going and hope no one notices. And then there's the unspoken hierarchy. Doctors make mistakes all the time, but admitting them? That's a different story. Nurses, orderlies, and techs see things going wrong medications being given, signs of distress being ignored, a patient deteriorating faster than the doctor predicted, but speaking up? That's dangerous. You get labeled as difficult, as someone who doesn't know their place. I learned that the hard way. There was a patient, a young woman, barely 30, who came in after fainting. She had a history of migraines, so the doctor waved it off. Just dehydration, he said. Give her fluids and send her home. But something felt off. She was too pale. Her breathing was shallow. I had seen dehydration before, this wasn't it. I voiced my concerns. The doctor barely looked at me. She'll be fine, he said, already moving on to the next case. She wasn't fine. A few hours later, she coded. Her body was shutting down because she had an undiagnosed blood clot traveling to her lungs. A simple test could have caught it in time. A simple test, a few extra minutes of attention, and she would have walked out of that hospital alive. Instead, she left in a body bag. And no one talked about it. No one reviewed the case. No one admitted that maybe, just maybe, a mistake had been made. I went home that morning and sat in my car for an hour, staring at the dashboard, hands gripping the wheel so tightly my fingers ached. And then I went back the next night, put on my scrubs and did it all over again. Because what else was I supposed to do? That's how the system works. You follow the rules. You keep quiet. You do your job. And you hope, pray, that next time it won't be you watching someone die just because nobody listened. There's something deeply unsettling about realizing that a hospital, the place people go to for safety, can be just as dangerous as the illness that brought them in. That the system itself, the protocols, the efficiency measures, the obsession with numbers, can be the very thing that kills them. I don't think people understand how fragile it all is. We rely on the assumption that hospitals are prepared for anything. That when an emergency happens, everything clicks into place. The truth? We're always on the edge of collapse. Always. There are never enough staff, never enough beds, never enough supplies. A single bad night, a mass casualty event, a sudden flu outbreak, even just too many critical cases coming in at once, can push an already overstretched system into chaos. And when that happens, mistakes aren't just possible. They're inevitable. I've worked shifts where the ER was so packed that patients were lined up in hallways for drips hanging from whatever hooks we could find, their gurneys pressed against walls like forgotten luggage at an airport. I've seen patients left waiting for hours because there was no doctor available to see them, their conditions deteriorating right in front of us while we tried to juggle 10 other emergencies at once. And then there are the supply shortages. People assume hospitals are stocked with everything they need. That there's always enough medication, enough blood, enough equipment. That's a lie. I've had to tell a trauma patient's family that we didn't have the blood type their loved one needed. I've watched a nurse break down in a supply closet because we ran out of basic pain meds, and all she could offer a post-op patient was a half dose to make it last. I've seen doctors forced to choose between two critical patients because we only had enough of a life-saving drug for one. And the worst part? This isn't some rare crisis-level situation. This is normal. It happens in every hospital, every day, and no one talks about it. The public only finds out when things get really bad, when there's an official shortage of something vital, when hospitals have to start turning people away, when the media catches wind of the fact that people are dying because we don't have what we need to save them. But those are just the extreme cases. What people don't realize is that we are always working under those conditions, just barely holding things together, hoping we can stretch our supplies long enough to get through another shift. And then there's the issue of misdiagnosis. People think medical mistakes happen in rare, extreme cases, but they don't. They happen constantly to ordinary people in ordinary situations. A woman comes in complaining of dizziness, and they tell her it's anxiety. Turns out it's a slow brain bleed that no one caught in time. A man has persistent stomach pain, and they dismiss it as acid reflux. Turns out he has an aggressive cancer that could have been treated if they had caught it earlier. A child is sent home with a fever and some Tylenol 3 days later. They're back in full organ failure because it was meningitis all along. You know how they teach us to spot life-threatening conditions? By memorizing statistics. Only 1% of patients with these symptoms will have a serious underlying cause. Only a small percentage of headaches are actually brain tumors. Only a fraction of chest pain cases are true cardiac events. The system isn't designed to catch every case. It's designed to play the odds. And sometimes the odds aren't in your favor. And yet we are told to trust the system. To believe that if something were truly wrong, we would catch it. But I've seen too many people slip through the cracks. I've seen people die because their symptoms weren't textbook. Because they didn't present typically. Because someone decided, consciously or not, that they weren't worth a second look. And the thing is, when you work in the system long enough, you learn how to play the game. You learn which cases to prioritize, not based on urgency, but based on who is more likely to cause trouble if you get it wrong. A well-dressed businessman with good insurance gets a full workup for his chest pain, even if it's probably nothing. A single mother on Medicaid gets a cursory exam and some painkillers, even if something more serious might be lurking beneath the surface. You learn which tests to order, not based on what's best for the patient, but based on what the insurance company will actually pay for. You learn which procedures to push because the hospital makes more money from them, and which ones to avoid because they're a financial burden. You learn to move quickly, to cut corners where you can, to document just enough to cover yourself, but not so much that you slow things down. And slowly you stop asking questions. At first, I fought against it. I tried to push back, to advocate for patients, to question why certain decisions were made. But the system doesn't reward people who push back. It punishes them. I learned that when I tried to report a doctor for prescribing unnecessary tests to a patient just because their insurance would cover it. I was told to mind my own business. That I wasn't a doctor, so it wasn't my place to question their judgment. That if I kept making trouble, I might find my hours cut. My schedule suddenly filled with back-to-back night shifts. My job reviewed for performance issues that hadn't existed before. So I stopped pushing. And that's how it happens. That's how good people who went into this field because they wanted to help, become part of the problem. Not because they don't care, but because caring too much is dangerous. Because if you let yourself feel every injustice, if you let yourself acknowledge every time the system fails, you won't last. And that's the hardest part of all. Realizing that the only way to survive in this job is to stop feeling. And I don't know if I can live with that anymore. There's something hospitals will never admit. They run on exhaustion. They are powered by the sleepless, the overworked, the burned out. The entire system survives because of people who are barely holding themselves together. I have worked 16-hour shifts without a single break. I have gone entire nights without eating because there wasn't a free minute to sit down, because every time I tried to take a breath, another emergency pulled me back in. I have seen doctors fall asleep at their desks in the middle of writing patient notes. I have watched nurses cry in storage closets, silently, quickly, before pulling themselves together and walking back onto the floor as if nothing happened. People think of hospitals as places of precision, as places where medical professionals are always at their best, sharp and focused, making life or death decisions with clear minds. But here's the truth, half the people treating you are running on fumes. And mistakes happen when you're running on fumes. I have seen patients given the wrong medication because a nurse was too tired to double-check the label. I have seen IVs hooked up incorrectly, machines left unplugged, charts misread, all because the people responsible for them had been awake for too long, had been running between too many patients, had been surviving on caffeine and adrenaline for hours on end. And when mistakes happen, the system never blames itself. If a doctor misdiagnoses a patient after their 30th hour awake, the hospital doesn't question why they were forced to work that long in the first place. If a nurse makes a critical error because they've been juggling too many patients, the administration doesn't ask why staffing levels are so low. No. The blame is always placed on the individual, never the system that set them up for failure. And the worst part? The exhaustion isn't an accident. It's a strategy. Hospitals deliberately understaff. They cut costs by reducing the number of nurses on a shift, by stretching doctors thinner, by forcing everyone to do more with less. Because as long as the job gets done, they don't care how. They don't care that people are breaking under the weight of it. They don't care that patients are suffering because their caregivers are too tired to function properly. And patients don't know. They don't realize that the doctor they're trusting with their life hasn't slept in 20 hours. That the nurse rushing to administer their medication is juggling 10 other patients at the same time. That the person stitching their wound is fighting to stay awake. And no one talks about it. Because in medicine, admitting you're tired, admitting you're overwhelmed, that's weakness. That's failure. And failure isn't an option. So we push through. We ignore the pounding headaches, the shaking hands, the slow, creeping numbness that settles in after too many consecutive shifts. We learn how to function through exhaustion. We teach ourselves how to make life or death decisions even when our brains are screaming for rest. And sometimes we get used to it. That's the scariest part, how normal it starts to feel. The exhaustion becomes background noise. The mistakes stop shocking you. The losses stop hitting as hard. I remember the first time a patient died under my care. I remember every detail, the way his breathing slowed, the sound of the monitor flatlining, the frantic, useless attempts to bring him back. I remember the weight of it, the way it sat heavy in my chest for days. And I remember the first time I didn't feel anything at all. It was months later, another loss, another body covered with a sheet, another family crying in the hallway. And I felt nothing. That's how you survive in this job. You stop feeling. You tell yourself it's just part of the job, just another shift, just another patient. You bury it. Because if you let yourself feel everything, if you let yourself grieve every mistake, every loss, every moment where the system failed someone, you wouldn't last. And the system needs you to last. Because hospitals don't care about individuals. They don't care if doctors burn out, if nurses quit, if good people walk away because they can't take it anymore. There's always someone new to take their place. There's always another fresh-faced, eager graduate ready to step in, full of optimism, full of hope, completely unaware of what they're walking into. I used to be one of them. I used to believe in the system. I used to think medicine was about healing, about saving lives, about making a difference. But now I know the truth. Medicine isn't about saving lives. It's about sustaining the illusion that we are. And once you see behind the curtain, you can never unsee it. People assume that hospitals are the safest places in the world. That no matter what happens, if you make it to the hospital, you'll be okay. But the truth? The truth is that hospitals are dangerous. Not because of diseases or accidents, but because of what happens behind the scenes. Because of the things we don't talk about. Let's talk about the patients who never get the right diagnosis. The ones who come in with symptoms that don't fit neatly into a textbook definition, who don't present typically, who are shuffled from one department to another until eventually, they give up and stop coming. I've seen it happen over and over again. A woman comes in with chronic pain, and because her blood work looks normal, the doctor decides it's all in her head. A young man faints randomly, but because his heart monitor doesn't immediately show anything life-threatening, he's dismissed as dehydrated. A child develops a mysterious rash, but because the insurance company won't cover further testing, they send them home with nothing but antihistamines. Some of these people get lucky. They find another doctor, another hospital, someone willing to dig deeper. But a lot of them don't. A lot of them leave without answers and never realize that what's happening to them is serious, until it's too late. And then there are the patients who die because of money. You might think, but hospitals have to treat everyone, right? Yes, in theory. But in reality, money dictates everything. If you have the right insurance, you'll get a private room, extra tests, the newest medications. If you don't, you'll get the bare minimum. You'll wait longer. Your tests will be delayed. Your doctor might spend 5 minutes with you instead of 15. And if you can't pay at all? I've seen patients turned away because they didn't have insurance. I've watched hospital administrators tell doctors, straight to their faces, don't waste too much time on that one. They won't be able to afford follow-ups anyway. I've seen life-saving treatments denied because a patient's insurance company deemed it not medically necessary. And I've watched those same patients die. Hospitals like to present themselves as places of healing, but the truth is, they are businesses first and care providers second. Everything is about cost efficiency. How many beds are filled? How quickly can we move patients in and out? How can we cut costs while maximizing profits? And that obsession with numbers? It kills people. It leads to hospitals cutting down on staff so they can save money on salaries, which means fewer nurses, fewer techs, fewer hands available when something goes wrong. It means patients waiting in pain because there aren't enough doctors to see them. It means crucial tests delayed because someone somewhere decided it wasn't urgent enough. And then there are the things hospitals don't want anyone to know. Like the fact that medical equipment isn't always sanitized the way you think it is. I've seen surgical instruments rinsed instead of properly sterilized because someone was in a hurry. I've seen single-use items quietly disinfected and reused because supply orders were delayed. I've seen gloves and masks rationed, even in high-risk areas, because administration didn't want to waste resources. Or the fact that some patients are treated differently based on their appearance. It's not supposed to happen, but it does. If you walk into the ER well-dressed, speaking confidently, looking like someone with money and education, you'll get more attention. If you come in looking like you live on the streets, if you don't speak English well, if you seem like someone who can't afford to sue, it's a different story. Or the fact that hospitals hide their infection rates. You know those hospital-acquired infections you hear about? The ones where a patient comes in for surgery and ends up with pneumonia, or a staph infection, or something even worse. They happen way more often than hospitals admit. I've seen entire units dealing with outbreaks of antibiotic-resistant bacteria, and instead of shutting things down, instead of properly informing patients, hospitals will quietly shuffle things around, move patients to different wings, change reporting methods so the numbers don't look as bad. Because admitting the truth? That would be bad for business. And then there's the unspoken reality that not every patient is treated as someone worth saving. No one says it out loud. No one writes it down. But it happens. A 90-year-old comes in with severe pneumonia, struggling to breathe. He's not a priority. Resources are limited. They focus on the younger, healthier patients first. A homeless man overdoses and is rushed in. They stabilize him, but there's no rush to get him the best possible care. Because in their minds, he'll probably be back next week anyway. A woman on government insurance is diagnosed with an aggressive form of cancer. They offer her the cheapest treatment plan. The one that's covered. Not necessarily the one that could save her. No one questions these decisions. No one talks about them. It's just the way things work. And we learn to live with it. We learn to tell ourselves that we're doing our best, that it's not our fault, that the system is what it is and there's nothing we can do to change it. Because the alternative? The alternative is admitting that we are part of something that isn't about healing at all. And that's something most people in this field aren't ready to face. There's a moment in this job when you stop fighting. Not because you don't care anymore, but because you realize the system is bigger than you. At first, you think you can change things. You think if you just work hard enough, if you just speak up at the right time, if you just push back against the worst of it, something will give. But it doesn't. And then one day you stop trying. I don't know exactly when it happened to me. Maybe it was the 100th time I saw a patient denied care because their insurance wouldn't cover it. Maybe it was after my first 24-hour shift when I realized I was so tired that I couldn't even remember my own drive home. Maybe it was when I saw a patient coded as non-urgent who should have been treated immediately because when they finally got seen it was too late. Or maybe it was that night. The one I still can't stop thinking about. It was a quiet shift, at least as quiet as a hospital ever gets. The ER was packed, but there weren't any active trauma cases, no frantic resuscitations, no alarm screaming through the halls. Just the usual mess of sick and injured people waiting to be seen. And then she came in. She was in her 20s, pale, barely able to stand, clutching her stomach. Something was wrong. You could see it in the way she moved, the way her body curled in on itself like she was trying to hold herself together. She had been to another hospital earlier that day, but they sent her home with painkillers. Said it was probably just a stomach bug. It wasn't. We ran tests too late. Her appendix had ruptured hours ago, spreading infection through her body. By the time they got her into surgery, she was already septic. She didn't make it. And the worst part? It wasn't even a mistake. Not really. The first hospital followed protocol. They saw a young, otherwise healthy woman with abdominal pain and assumed it was nothing serious, because statistically it usually isn't. They played the odds. And she lost. That's when it hit me. Hospitals aren't designed to save everyone. They never were. They are designed to function. To keep moving. To treat just enough people, just well enough, to maintain the illusion of control. But control is an illusion. I've seen surgeries go wrong because a doctor's hands were shaking from exhaustion. I've seen patients suffer because a hospital administrator decided we didn't have room in the budget for extra staff. I've seen medication doses guessed instead of calculated because the pressure to move faster was more important than the need to be precise. I once watched a doctor order a cheaper medication for a patient, even though he knew it wouldn't work as well as the more expensive one. He did it because the insurance company would reject the better drug unless the patient failed the cheaper treatment first. He wasn't trying to be cruel. He was just following the rules. And that's what's so terrifying about all of this. No one sets out to hurt people. No one wakes up and decides to let someone die. But the system is built in a way that makes failure unavoidable. The doctors are overworked. The nurses are understaffed. The hospitals are underfunded or worse, run by corporations that care more about quarterly profits than patient outcomes. And patients? Patients don't know any of this. They trust that if something is wrong, we'll catch it. That if they are in danger, someone will notice. That if they are dying, someone will save them. But I have seen people die waiting for a doctor to check on them. I have seen people go into cardiac arrest because their symptoms weren't taken seriously. I have seen patients discharged too soon because keeping them longer would mess up the hospital's efficiency scores. And I've stopped being surprised. That's what scares me the most. When I started, every death felt like a failure. Every mistake haunted me. Every time I saw the system break someone, I wanted to scream. But now? Now it's just another shift. Another patient. Another body moved from one room to another. Because what else can I do? I can't change the system. I can't force hospitals to care more about people than profit. I can't make insurance companies stop playing God with people's lives. All I can do is my job. So I do it. I clock in. I treat who I can. I follow the rules even when they don't make sense. I try not to think about the ones who fall through the cracks. Because if I think too much, if I let myself really feel all of it, I know I won't be able to keep going. And the system needs people like me to keep going. Because without us, the whole thing collapses. And if that happens, where would people go? Where would they turn when they have nowhere else left? Because as broken as hospitals are, as cruel and chaotic and indifferent as the system is, what's the alternative? There isn't one. And that's the real horror of it all. There's a silence that settles into hospitals late at night. Not the comforting kind. Not the peaceful kind. It's the kind that makes everything feel heavier. the kind that wraps around you and presses against your chest, reminding you of everything you've seen, everything you've ignored, everything you've forced yourself to forget just to keep going. I used to hate night shifts. Now I prefer them. During the day, there's too much movement, too many people pretending that everything is fine, that the system works, that we are in control. At night, when the halls are dim, when the only sound is the beeping of machines and the occasional distant cry of someone losing a battle they never had a chance of winning, the truth is harder to hide. Because hospitals are full of ghosts. Not in the way people think, not the kind that haunt rooms or flicker in the corners of your vision. No, the real ghosts are the ones that linger in your memory. The ones you carry with you. The patients you should have saved. The ones you lost because of a decision someone else made. The ones who walked in trusting that we would take care of them and never walked out. And after enough time you stop counting. You stop keeping track. Not because you don't care, but because if you let yourself remember every single one, you wouldn't survive. I remember a man, mid-50s, came in with a sharp pain in his abdomen. He was sweating, nauseous, gripping his side like his body was splitting open. The textbook signs of something serious. But he was uninsured. So instead of an immediate CT scan, instead of priority care, he was given painkillers and told to wait. He sat there for hours. He waited while doctors rushed to treat people with better insurance. He waited while the staff tried to juggle too many cases with too few resources. He waited while the system decided whether or not he was worth saving. And then he collapsed. His appendix had ruptured. The infection spread. And by the time they finally took him in, it was too late. He died because of a delay that never should have happened. Because someone somewhere made a decision about what his life was worth. And that's the part that haunts me the most. Hospitals like to talk about patient care, about ethics, about doing no harm. But the truth is, every day people die not because their condition was untreatable, but because the system decided they weren't a priority. We are taught to believe that medicine is fair. That it's about science, about skill, about doing everything possible to save a life. But I have seen firsthand that medicine is also about money. About convenience. About knowing which patients will make noise, which ones will file complaints, which ones will be a problem if you don't handle them right. I've seen doctors ignore a black woman's pain, assuming she was exaggerating. I've seen elderly patients left to deteriorate because aggressive treatment wasn't considered worth it. I've seen overdoses dismissed as self-inflicted while someone who drank too much at a party was treated like a priority. And I've stopped being shocked. That's what frightens me the most. Not just what I've seen, but how normal it's all become. When I started, I thought I would be saving lives. I thought medicine was about knowledge, about precision, about science. But it's not. Medicine is messy. It's full of compromise and shortcuts, of decisions made under pressure, of people hoping they're making the right call even when they know they don't have all the information. And the system itself? It's not built to save people. It's built to function just well enough to maintain the illusion. I used to believe that if I worked hard enough, if I cared enough, I could make a difference. But I've learned that hospitals don't reward the ones who care too much. The ones who question things. The ones who refuse to look the other way. I have seen good nurses quit because they couldn't take it anymore. I have seen brilliant doctors walk away, burned out and broken, knowing they could no longer justify what they were a part of. And I have stayed. Because the truth is, I don't know what else to do. Medicine is all I have ever known. It's all I ever wanted to do. And even though I see the cracks in the system, even though I know how much of it is broken, I don't know how to walk away. So I keep showing up. I keep watching patients fall through the cracks. I keep following orders, even when they don't make sense. I keep doing my best, even when I know my best won't be enough. Because at the end of the day, what else is there? If I leave, nothing changes. The system keeps running. More people come in. More people are sent home too soon. More people die waiting. And the worst part? Most of them will never even realize that the system failed them. They'll believe their diagnosis was fair. That their insurance just didn't cover the better treatment. That they just got unlucky. Because that's what hospitals are best at. Not healing. Not saving. But making sure people never question how close they came to slipping through the cracks. And I don't know how much longer I can live with that. If you've made it this far, maybe you're questioning things. Maybe you're thinking back to a time when you or someone you love was in a hospital, trusting that they were getting the best care possible. Maybe you're wondering how many people don't realize they've been failed by the system. Or maybe you don't want to believe me. Maybe you want to believe that hospitals are safe, that doctors always know what they're doing, that medicine is as precise and controlled as they make it seem in TV shows and movies. I used to believe that too. But after everything I've seen, after everything I've been a part of, I can't believe in that illusion anymore. I know what happens behind the scenes. I know how the system prioritizes profit over patience, efficiency over accuracy, numbers over lives. I know that people slip through the cracks every single day, not because they couldn't have been saved, but because the system was never built to save them. And I know that most people will never question it. Think about it. How many times have you walked into a hospital and just assumed that everything was running the way it should? That the person treating you was well-rested, fully focused, had all the time in the world to make sure nothing was missed? How many times have you taken a diagnosis at face value without questioning if it was given too quickly, if it was based on assumptions, if the person making the decision was under pressure to move on to the next patient? How many times have you trusted the system without realizing that the system doesn't always deserve your trust? I don't say this to scare you. I say it because I wish someone had told me the truth before I started this job. I wish someone had warned me that medicine isn't about saving everyone, it's about keeping the machine running. That hospitals aren't built to help people, they're built to function just well enough to avoid collapse. And that people like me, the ones who see it all happening, learn to keep quiet. Because speaking up doesn't change anything. It just makes you a target. I have learned how to live with the weight of it. How to clock in, do my job, and ignore the parts one can't fix. But can you? The next time you or someone you love walks into a hospital, will you see it differently? Will you ask more questions? Will you pay attention to the way things are rushed, the way decisions are made? And if you've ever really had an experience, if you've ever felt like something wasn't right, if you've ever seen someone you love get brushed aside, if you've ever walked away from a hospital feeling like you were just another number, then I want to hear it. Because these stories matter. Because the only way anything ever changes is if people stop blindly trusting the system and start demanding better. But the real question is, will they? Or will they keep believing in the illusion right up until the moment it fails them?